Welcome back. This is my book Nook, and this is a series all about a resource guide for hip replacement surgery. We are on chapter 2. If you've been here before and watched the previous videos, thank you for coming back. If this is your first time here, my name is Tiffany Anderson. I am a health educator, an alternative healthcare provider, a wellness coach, a patient advocate, and I wrote a resource guide called Butternut to Bionic. And there are recovery tips in here for nearly any type of surgery. The last video, I talked about a free PDF that I put together with suggested questions for your surgeon. That is free. I will drop a card to that video if you want to go back and check that one or go back to the beginning of the series. This is going to be on chapter 2. We're on page 28 and focusing on getting ready for the big day, the day of surgery. The quote I started this chapter out with, I really like quotes of empowerment. Those are things that boost my mood. I like positivity. I like to start the day with fitness and movement, and I like to end the day with comedy. Those are things that support me and take me through rough days and are things that I look forward to. How about you? What are the things that you like to have as far as the rituals and your daily routines that keep you going even when things get rough? If you're anything like me, you are perhaps a mature adult. I turned 60 this year. I've been managing chronic conditions for nearly 3 decades now, a number of different health conditions, and I am a dual hip replacement recipient. That's the biggest reason that I wrote this book, is because the guide I wish I would have had that looked at joint replacement surgery from a holistic perspective wasn't available to me. And based on the methods that I put into place, because I had been working in alternative health and was very active in how I approached my health and well-being, I took all of those tools as a foundation and approached my surgery and recovery in that way with my physician and my surgeon, other healthcare providers. That's how this book all came into place. Let me tell you the little bit of insights and background on here. I think I just bumped the mic. I'm sorry. This quote, Jackie Joyner Kersee. And she said, "It's better to look ahead and prepare than to look back and regret." Now, that's certainly something that could apply to nearly any situation, goal, thought process, and it seemed really appropriate for preparing for surgery. And with hip replacement, I open this up by saying that timing is one benefit, because the majority of hip replacement procedures are planned well in advance, not always. And because of that timing, generally, patients have time to prepare their home and coordinate time off work, schedule caretaking needs if needed, rehabilitation centers if needed, and also to help prepare yourself mentally and emotionally, because this is truly life-changing. If you already have some metal in your body, you will have a basic understanding of how significant having a new joint, especially a joint as large as a hip joint. Knees are also a significant. Now, there's other, you can have a jaw replacement. There's a lot of other ways, dental implants. There's many ways we can have metal in our body. With a hip joint, there's significant changes to your physical well-being and your physical abilities, your mobility, your gait. And, afterwards, the recovery time varies per person, and that will vary especially based on your health going into the surgery, your age, and your other health situations that you might already have in place. I went into the surgery with a little bit of arthritis, and that has gotten significantly worse, as many degenerative conditions tend to do. And I also have Hashimoto's disease, and that started in my 30s. The thyroid impact has been significant in regards to all of my medical care, just for the fact of how it affects my mood, my metabolism, and a general state of well-being. And those are the ones, when you take all of your medical conditions into consideration and talk to your doctor, that's where that perfect teamwork approach with your healthcare providers to work in concert together so that you can better manage all of those chronic conditions. And I want to do that as healthfully as possible and with less invasive methods. One of the aspects of my foundational approach to well-being, and something that I've put into place for years, since 1996 is when I entered the field of health, I have a philosophy and a three key concept approach. If you've been to my website, it's andersontherapeutics.com. There are a number of free tips, resources for any adult, any caregiver, even healthcare providers that are looking for ways to better their health, improve their health, take better care of relatives, and to become a more active participant. That is one of my mottos. Become a more active participant on your journey to improved health. And those three key concepts are how I manage my chronic pain. It's how I prepare my meals and nourish myself. And it's how I ensure that I stay active and independent, and how I get enough rest. Those are the basics of my day that gives me that strong foundation. So when crises like illness, hip replacement, all of those things come into play, that foundation can give me a stronger base and improve my likelihood of success to heal quicker, to have less pain, and to better manage all of the situations as I move forward in life. Those are other aspects of my book and why I'm sharing this here, because I published this in 2016. Granted, it's been out for a while. Are there a few things in here that are outdated? Yes. And that's why, as I skim through each of these chapters, I want to give you the insights of, what happened then and how I have successfully gotten to where I am now. Back when I first got sick in 2009, received my first joint replacement in 2011, and I still have those parts and plan to take them to the grave. And there's a goal plan. There's a whole set of procedures, lifestyle medicine, healthy lifestyle behaviors that I have in place that are working well for me, and that I'm sharing with clients that I coach and other patients that I'm talking to as an advocate, and even in the past in caregiving roles that I have helped others to better manage their health. Now, I'm not asking for anyone to be a carbon copy. The things that I have on my website and all of the resources in here, of course, are suggestions, their advice, their tips based on my own experience. A lot of these have been from my healthcare providers. So, yes, big disclaimer, I am not a healthcare provider. I have worked in clinical fields, and I also know the limitations of my practice and what my credentials as a health educator. Even in alternative health, there are certainly things that are well beyond my scope of practice. My strongest forte is that I am a writer. That is my strength. I've recently finished an ebook, and that is going to be released soon, and it is an extended version of my 3 key concepts in a workbook format. I have shared the pre-order info on that, and I will add that here as well if you're interested in looking at that guide. It's on pre-order right now. It'll be released in December of 2025. Though go to my website, andersontherapeutics.com, and look at the 3 key concepts. The foundation and the introduction to each of those concepts is at my website, and everything on that website has been freely available since 2016. As you're looking at preparation for surgery, and perhaps this is for someone that you're taking care of, perhaps it's in your near future, perhaps it's in the distant future, it's something that you're anticipating that may happen in your life. The tips that I have in here, some may seem incredibly basic and others are quite extensive, including things that specific to joint replacement that I certainly hadn't thought of. And since I hadn't met anybody at the time who had joint replacement, I was 45 at the time, and it was really a wake-up call and shocking to me that I believed I was very fit, and I would have never believed, even my own physician was shocked when we ultimately found out, with all of my health problems and this bizarre medical mystery tour that I went on, and why it's called Butternut to Bionic. It was a bizarre health tale. And my doctor would have never believed that the head of my femur basically collapsed. Unknown etiology. They still have no idea what happened. I didn't have a fall. I wasn't injured. I wasn't in an accident. It simply collapsed. There are any number of reasons why an individual may need a joint replacement and may need a revision surgery. They're very complicated surgeries, and it changes the trajectory of your life, and you never quite know if you're going to need future surgeries, and you really want to do your very best to prevent them, because the procedure itself is so, I mean, you're basically having your leg rebuilt. As much as procedures have improved and there's robotic arms and all sorts of amazing medical phenomenons actually that are required to install this equipment, that it's still, I mean, think about, your femur and your hip joint, so there's that ball and socket, and mine are now a ceramic cup, and then down through my femur there is a titanium stem. So where there used to be all of that marrow and all of those elements in a healthy bone and joint, where the T cells for immune function would be made, for me, now that's full of titanium, cement, all sorts of other metal. So I forever now have a compromised immune system just for the fact that a lot of my bone marrow is now replaced with artificial parts. And learning to live well with that knowledge and not freak myself out and do my best and, go out into the world and take risks and remain independent. And now, I'm living solo and plan to, as long as I can. I want to remain independent, and doing that takes a lot of confidence in your abilities and your safety, and knowing that you are doing your very best to invest in your health, because the risk of, infections, and there are certain contraindications and ways that I can and cannot move. Bending past 90 degrees puts me at a severe risk for dislocation. And I don't want to face my day with fear. That's why being incredibly proactive in investing in my health and well-being, I feel that helped me be the most successful patient, and I healed quickly compared to some of the other patients that my surgeon was working with. Now, did it happen as quickly as I wanted it to? No. I was pretty shocked after my second hip replacement and I needed a revision that I was on crutches for 18 weeks, and it was challenging learning to walk again and to get my legs in balance and become accustomed to having one leg that was a little bit heavier than the other one because of the extra equipment installed. Another aspect of this chapter that some may feel is sensitive and even inappropriate, which I found shocking when I got feedback on this. On page 30, there is one paragraph that talks about, as you prepare for surgery, to also prepare a living will. And this is something that I honestly encourage any adult living on their own, and certainly any adult that has a significant other, and certainly any adult that has children, that you should have a living will of some kind. That, in my mind, is a personal responsibility. It's an accountability moment for any adult to say, this is how I am holding myself responsible for my health, and what's going to happen when I reach that ultimate time that we all reach in life, is when our life ends. That to me is not a frightening, it's not a doomsday type of approach. Now, I know that for some, I've certainly known a lot of people that the topic of death and end of life is frightening and can be painful. And reframing that in a way, knowing that for anyone going into surgery, when any surgery can be risky, anytime a person is ill, that's risky. And wouldn't you rather have a living will and have all of your preparations handled and in a legal document that you've done when you're relaxed, when you're in your right mind, when you've had time, whether you're, speaking to an attorney, a trusted friend, family, whoever you want to have as a guide through that process, and signing your name to it and knowing that those are your wishes and that you've shared them with your family and anybody else that it impacts. It's incredibly important to put that into place. in my book, I have a link to the advance directives, and there are one specific, and since I'm in Utah, I'm in the States, that this is specific to the US, and of course this would vary depending on where someone is. And there are, now with the internet and going online, there are a number of trusted resources that you could go to, and of course your local library. I would always suggest anyone go to a library. Librarians are just incredibly intelligent, educated people, and have all sorts of resources to help you. As I move on to extra steps in this chapter, I also talk about managing stress as you're preparing for surgery. And it's a significant percentage of people that, depending on the attitude that you have going into surgery, that there's a greater rate of success based on perception, your feelings about how well you will do, and certainly how well you feel supported in your world. And that this isn't a given, though. With stress management, we all know that stress impacts our health. And chronic stress, toxic stress, acute stress impact it in a negative way. And anytime our bodies are in a state of fear and trauma, that our immune system is suppressed and our adrenal glands are heightened, all of those things are creating the fight or flight. I'm sure you've heard that response in our bodies, and even the most gentle ways, the minimal ways that you're thinking about managing stress, extra deep breaths, time listening to music, however you like to manage stress, those things are crucial. One of the things that I used, and all the way through becoming ill up until day of and into surgery, was listening to guided imagery. And at the time, there were CDs, and I had an MP3, MP4, whatever. I'm an older adult, not the greatest techie person. I actually got permission with my surgeon, the anesthesiologist, and I went into the surgery room with the earbuds in and listening to that. And they waited until the anesthesia was on and taken effect, until they gently removed those. And I even, my surgeon was just incredibly progressive man. And even though I didn't meet the anesthesiologist until the day of my surgery, I asked them both to please share positive affirmations to me. And they played music during the surgery, which is something my surgeon liked to do anyway, and knew that there's plenty of research out there that has shown that anything heard in the surgery room, even though the patient is out of it, that our subconscious is just like when we're sleeping, we're still listening to all of that. So to have that heightened state of hearing supportive words and the affirmations of, you're doing well, the surgery's a success, you're going to heal, we have confidence in this, any amount of supportive statements, that positivity in the background is impactful. And I felt more encouraged and supported, and I wasn't as frightened going into something that was incredibly foreign to me. I had been very lucky up until the time that I received joint replacement I was in my mid 40s and I hadn't been in a hospital since I had had my son in 1987. So I had a long time in my life that I was very lucky that I hadn't ever needed a surgery or had a serious illness. And to be able to go into that operating room feeling that level of control, because I had asked for something that, they didn't need to do that for me, but all of the medical team were very supportive and they were incredibly kind. And there's a lot of gentle ways to manage stress. And all the way up through preparing for surgery. And I say this with kindness and empathy, that I know how painful it can be as you're waiting for that time, especially if you have a lot of other aggressive health conditions going on as you're waiting for that joint replacement. Stay as active as you possibly can. And there are movement therapies out there, and especially on YouTube now. One of them that I used after surgery, it was a workout routine designed for people who were paraplegic. They were in wheelchairs, and it was just minimal movements that they could do. So any amount of movement that you can do, even if it's a facilitated stretch where you're having someone assist you, if it's a deep breathing exercise, just to simply move your diaphragm, expand your rib cage, stretching. Maybe it's just pointing your toes and flexing your ankles. Maybe it's just however you can move. All of that movement is going to help with increasing circulation, keeping the oxygenation of the blood, all of that support, every little bit of supportive movement that you can do right up until surgery, and then as soon as you can afterwards. Because guaranteed, after joint replacement, the physical therapist and the surgeon or surgeon assistant, someone will be in your hospital room, and you are expected to get up and start moving that day. And it's unpleasant, but it needs to be done. I'm going to end with this here up on page 34 and remind you again, please go and check that previous video and download that free PDF that I've shared that gives you questions for your surgeon, and it could apply to any type of surgery. You can certainly customize it. It gives you some different tips specific to joint replacement and some that are for any type of procedure. And while you are looking at my website, I would encourage you to also go to the suggested resources. Now there's a pop-up. Some people are not having luck finding this, but it's called My 4 Proven Methods to Manage Chronic Pain. This is another free PDF, and you can get this on my website. You can download this guide here. It talks about one of my favorites, and this is something that I've had in my medicine cabinet for a long time. If you can see, it's called Arnica. Now this is the gel form, and I've used this for years, even when my son was young and at home. This is great on bruises. It's great on strains, sprains. It's a topical, of course, and it's really amazing how you can have a pretty severe bruise, and for us that are older, we have that more frail skin, and I certainly bruise a lot easier than I used to, and I don't heal as quickly. This stuff here will help to take a bruise down. I mean, I can have a, a really harsh purpley looking bruise, and this will take it to the yellow stage pretty quickly, and it helps with the pain as well. I like that it's not intrusive, it's inexpensive, and that it's, there's no negative side effects. There's also arnica that come in the little homeopathic, the teeny tiny little pellets that you'll see in the little blue tubes, and you just put those under your tongue. Now, even my surgeon, after my surgery, he told me to start taking arnica as soon as I felt well enough to start eating. And that type of arnica where you're ingesting it is really helpful for any type of internal injury. This gel here would never go on broken skin. This is for, like I said, more of a bruise, strain, sprain, that type of thing. It's great for pain, for achiness. It's a very gentle form. This isn't sponsored by any means, though I will have an affiliate link down below if you want to check this out. And it's something I've had in my medicine cabinet for years. It was great for, sports. It's just one of those first aid items that I have on hand. And even my dentist, my current dentist, he talks about arnica. So when I've had dental procedures, I have a couple of dental implants, I've used arnica afterwards, and it just speeds up the healing. And then I don't have to worry about, I just don't want to take any more pills than I have to. And things like this are inexpensive. And as I said, they're non-intrusive. I don't want a list of negative side effects. This doesn't have any negative side effects. So that's my that's my other suggestion for you. Well, thanks again for watching, and please give this a like. Consider subscribing if you found this useful. I have a whole series of videos that talk about my Nourish philosophy and show examples of my plant-based diet and some of the yummy meals that I make and how I'm staying active and better managing my health. If you have any comments or questions, leave them below. Have a good day.